Hello everybody, thanks very much for inviting us to talk. My name's Mike Greenwood, this is Ruth Jennings. We're going to talk about Zanzibar, but I can certainly empathise with our previous speaker, because I was involved in the health service with the Byd-eang team link quite a long time ago and had those experiences of trying to do online teaching in Lesotho. But now we're talking to you about mental health in Zanzibar. We're both mental health nurses. I was a county manager in Britain. Ruth was a CPN in Zanzibar. So first of all, where is it? We've got a little pointer here, haven't we? Yeah, so we've got two islands. This is Unguja and this is Pemba. When people say they're going on holiday to Zanzibar, they mean Unguja. This is the main island. But Zanzibar itself is about 100 islands. So it's similar to Wales in that it's semi-autonomous. It's a part of Tanzania. And in the same way that we have a Welsh assembly, but we're under the UK government, so they've got the revolutionary government of Zanzibar that governs the island, but they're also under the government of Tanzania. So they're affected by what happens in Tanzania politically as well. So Unguja's about 60 miles by 20 and Pemba's a bit smaller, but there's less population. Most of the services are really concentrated in Unguja, and although Pemba's quite a big island, there's not a lot happening there. And so the main city is Zanzibar City, which is in Unguja, yeah. And so mainly it's spices. It's a spice island, it's known as a spice island. And the population is about 1.2 million. It's mostly a Muslim country. Average annual income is 350 quid. So half the people live on less than £1 a day. And this is Unguja, and this here is Zanzibar City. But most of the people sort of live around the coastal areas, and so it's actually quite difficult to get into the city. So the transport's a problem, and also because it costs a lot of money relatively. And then this next slide is this bit of coast here, and this is the road down the coast, and these are all resorts. One after the other, there's just miles and miles and miles and miles of resorts. And they're just metal gates with resorts behind them. And people are taken from the airport into there, and then they do the spice tour and the prison island and all the rest of it. And so it's all paid for in foreign currency abroad, and all the money goes back to mostly Italy, actually. So very little ends up in the islands. It's what's known as trickle-down economics, apparently. And you look at what's, this is, I think here we've got the Zanzibar Queen. This is what they're advertising, lots of nice food, very plush environment, nice, very expensive hotel. And it's, it's not surprising really, because this is Suleiman Abdul Ali, who's our partner out there, and Ruth. And we just walked out of one of the clinics in Pwani Machungani, and we just walk out onto the beach, and that's what it's like. It is a paradise island. Yeah, but the roads look like that. So it's really, it's really hard to get around. And then you see a lot of these type of blocks. This is where the local people, this is where the Zanzibaris live. They either live in these or they live out in the villages in huts. But I mean, this is not a good environment. This is that lady was one of the patients. We'll talk about that a bit later on, but I mean, she just lives in a 6x6 breeze block hut. There's no windows, tin roof that leaks, no toilet facilities, no bathroom, no kitchen, no electricity. That's just, there's this massive disparity in the wealth of all the Western tourists coming over and what's actually in the island. So the mental health services are run by the Ministry of Health in Zanzibar City, and they're mainly concentrated on Kidongo Hospital, where there's a male ward, a female ward, and a locked ward. And there is some occupational therapy, and there's a methadone clinic because there's some drug problems. But the treatment there is, people tend to be incarcerated in there for quite a long time. They're given, very old drugs that we stopped using many years ago, like chlorpromazine and so on. And this is a photograph of the female ward. It's really quite sparse. And we say that, the important thing for us is you've got to do what other people want. It's no good us coming in and thinking about what's a really good idea. It's about listening to what people want. So we asked them about this, and they said what we'd really love is a day out, and to get out of the hospital, because people are in there for months and months at a time. So we thought, okay, so we raised the money, and then we hired a couple of buses and filled people with buses and all the staff and the patients from the hospital and loads of food on a load of buses, and we took them to Nungwi, which is in the north of the island. It's a beach resort in the north of the island. And we had a really lovely day out, and we went, this is it's a sea turtle rescue centre where you can go and feed the sea turtles, and we had lots of lovely food, and we played lots of silly games. And, people really, really enjoyed the day out. And we had a football game against the local football team in Nungwi, and also took the opportunity while we were there to do some training with the local healthcare people about mental health. And so we do this that's happened when we happen to go along with, but we try and fund these. We raise money and fund these trips out, and it's just a way of trying to get these people, they have very difficult lives in the hospital, and they're very unfortunate people, and we just try and give them one nice day out a year.
Staff and patients.
Yes, so it's everybody. Okay, so Ruth is going to talk about primary healthcare clinics because she knows a lot more about it than I do.
Well, I'll just say a little bit about my history. It was about 17 years ago, I think it was, 2005 to 2007. And I went out to Zanzibar for VSO, voluntary service overseas, as a psychiatric community nurse, which I wasn't, I was just a nurse anyway. And basically, I worked with a colleague over there, Zanzibarian nurse, and the situation at the time was mental health services are pretty dire. They were based at Kidongo Chikundu Hospital, which is the one mental hospital in Stone Town, which Mike showed you before. And people from most of Zanzibar just couldn't get to the hospital. They have these little buses that would take them all day to get to the hospital, and they probably they couldn't afford it, most people, and then when they got there, they'd be lucky if they were seen, and if they were seen, there was no medicines, or they had to pay for them. And a lot of the patients that came to the hospital were actually the family of children with epilepsy, because that in Zanzibar, learning disabilities and mental health come together. I know that's wrong, but that's what they do. So there's a huge amount of epilepsy there. And then, so what my job was then was to work with my colleague Mohammed, going around on a motorbike and actually going to there was primary healthcare clinics around the island which dealt mostly with just like flu and colds, run by healthcare support workers. There's no nurses running them, and there was about 10, I think. So we went there and we established some kind of mental health facilities where the people could go. They didn't have to travel so far, go to these clinics and get basic mental health medications if they were lucky, but it helped a lot. So I was there 2 years, and then basically came back and I carried on supporting, and then we made a partnership, didn't we, with the Ministry of Health there and Suleiman, basically, and we helped to support the clinics to carry on. You got anything to say?
Well, this is a training session in the primary healthcare clinic. But the problem is transport. You talk about the motorbike.
Oh yeah, that's right. One of the things they wanted, because we always go on what they ask us to do. We know that we don't know, because they know, Suleiman especially, our colleague, knows what they want, and they wanted a motorbike so we could get to the clinics and see the patients, because otherwise it's pretty impossible. Couldn't afford a car. There's no Ministry of Health car for him to use. So he could get to the clinics and take medicine with him and see the patients, etc. So he bought a motorbike, raised the money for that, doing sponsored events. Yeah, and then this patient here you can see, this guy, I mean, this is an example. That's our colleague Suleiman there. This guy was chained up because that's what happens. It still happens now. People still get tied up and chained up, but he was given medicine because he was seen, and he's recovered now. But what still happens, what used to happen, is that people get so ill because they weren't seen. They get a critical stage and have to get to a hospital tied on the back of a truck, tied up. And yeah, that's what happened, wasn't it? But now, of course, they are seen. Most people are seen closer to their home in these clinics, and it's much easier. So the situation's better now. And we carried on supporting them, and then we got quite a few grants, didn't we, Mike? Yeah. Actually, do you want to talk a bit about that?
Yes. Well, So, but we pay every month for the petrol for the motorbike, and we pay for a lot of the medication for the clinics, because we were going to, I don't know if we've got a photograph of that, but we were going to clinics and they would see all of these people and go, well, you need medication, but we haven't got any. Yeah. And they can't afford it. So, and I know at one of the clinics, we said, well, where does the medication come from? They said, oh, there's a pharmacy across the road, you can go and buy it. So we just walked across the road, bought 15 quid's worth of medication, and that sorted the problem out. You know, so it's very small amounts of money, but for months on end, people don't get medication because there just isn't any. So we pay for the petrol and for the medication.
That's even for epilepsy. I don't know if anybody know, but phenobarbital and phenytoin is the ones that they use even now. And they used to do things like halve the tablets because they couldn't afford to buy. So obviously it doesn't work. So the children that were getting with epilepsy were having a lot of seizures, couldn't go to school, couldn't get jobs, all that kind of thing, isn't it?
There's a lot of discrimination against people because of that.
Yeah.
Okay, so we also work with the Zanzibar Psychiatric Association, and this is a really brilliant guy called Malingi. And somehow, I don't know quite how he manages it, but they've got this place in Babubu, and they've got a clinic, they give out medication, they raise money for medication, you can have all your tests done, their blood tests and so on. They do a fantastic job. And the other thing they do, going back to this lady who lived in the little shack, is, you know, there's no fallback for people. If you can't work, you don't eat. So you've got to make money. And so what he does, with our help, is provide equipment for people to make things. And then we've got a shop, which we partially pay for in Babubu, which is just outside Zanzibar City, where they sell things. So this is a way that people can make stuff and raise money. So, so here's this lady again, and she makes these dresses for the little kids. She's got a treadle sewing machine in her little shack. There's just a sewing machine and a bed in there, really. And she makes these dresses and sells them on the market, and that's how she makes money. So she's self-supporting.
Can I just say about her history?
Yeah.
She lost 3 of her children. Her husband walked out on her, and she had suicidal before this. So that's how serious it gets, isn't it?
Yeah.
Yeah. And there was another thing about a child that had epilepsy and was helped with, that was ZPA as well, they helped, and she got a little business just collecting seashells and selling them to people. It's very small. Yeah, I know it's small, isn't it? And we bought some rugs and that people were making. So this shop that they've opened, that's the idea of that, is for people recovering from mental health problems to sell the things that they make. Well, even if it's just juice and stuff like that, you know, it all makes money and they can get some kind of a living, isn't it?
Yep. So the other thing that we've been doing a lot of recently is health education. So a lot of this has been about dealing with the problems that, COVID, but also the discrimination that people with mental health problems face. You know, so we're trying to do a lot of training sessions with people and in schools and so on, and also. The people really, they don't go to the clinics, and they don't because they go to traditional healers, you know, and which is fine, but it doesn't always, they're not always getting the treatment they need. So and in COVID, of course, the whole thing of supporting people with mental health problems stopped. So we provided we paid for, got grants and paid for a whole load of training. We were training the mental health nurses for the use to you go with the COVID teams to use PPE and be safe to be able to go out in the community and help the people with mental health problems. And we were training the general nurses how to deal with people with mental health problems so that they could help them as well.
And
also,
the schools as well.
Yes, and also going out into schools and doing training sessions with kids about mental health, just to try and reduce the stigma early on, you know. And then it's very interesting, it's a very fascinating thing which I don't understand enough about, and I wish I did. And it's about traditional healers in Zanzibar, because they're registered with the government, and you're qualified and you're trained, and you have clinics, and there's a set of fees that you can charge for different things. And this is what most people, you know, go to traditional healers, and in fact they've done some research where most of the staff actually sort of believe this, rather than you know, going to a doctor or getting medication. People prefer to go to traditional healers.
Suleiman does.
Yes.
Our partner.
So yeah, so some of it is, it's a very complicated thing. You know, some of it is tied up with the Quran, words from the Quran on cups and so on, and others, and making potions from roots. It's a sort of a mixture, I suppose, of what was there before. But it's kind of one of the very interesting things about Zanzibar, which I can talk about for ages, but unfortunately we haven't got time, is that people, you know, I was a psychiatric nurse for 30 years. You see people in the UK with psychotic illnesses, and all the research shows that people in Zanzibar suffer less from psychotic illnesses and recover better, and it's less of a debilitating illness. And so people have a really different experience of it. So something is going on there that they're doing better than us, which is quite amazing. But it's, you know, it's really worth looking into that. And maybe there's a lot of research into this, which I'm happy to give people the information on. But you know, it's a very fascinating subject. So this is some of the roots and herbs that they're wrapped up in newspaper, and then this is a type of henna ink that they write words of the Quran. And then I think this is the last bit, because we do World Mental Health Day with
Coming
Zans.
up on Monday, isn't it?
That's right, yeah. So again, we've had some big celebrations. We do something every day. This is another football match. We gave them the footballs. But it's a really good way of getting out. You know, they have huge celebrations of it in Zanzibar. You know, big march through the streets, everybody from the hospital. It's a marching band, the whole lot. You know, it's great. But it's a really good way of you know, bringing that out into the community and sort of, you know, lessening the stigma.
That match was between the methadone clinic and the local youth. Yeah. And the methadone clinic guys took the football to the Mganga, the witch doctor, and had it sort of blessed so they'd win, and they did. So, you know, when you're out there, and like I was out there for 2 years, you start looking at all this traditional medicine, it's difficult to know what's right and what's not, because, you know, like with empathy, the thing being empathy, that's what people think and that's what they believe. So you've got to realise that's, you know, there's a lot of training, isn't there, with traditional healers. They refer now, don't they, to the mental health nurses as well, and they work together. Yeah. You've got to do that, because that's what people feel. So you've got to you know, honour that. I think
what I learned in my years as a psychiatric nurse is that the thing that works and makes people feel better is empathising with them, and it doesn't matter. You can do it as CBT therapist or by giving them medication, or you can go to a traditional healer. As long as somebody is listening to you and taking what you're saying seriously and
care about you,
you know, that just makes a huge difference to people. This was the patients we took out to the World Mental Health Day celebration. He wanted their photographs taken with us. So that's what we do, you know. But I mean, this is all about trying to ameliorate it's a very difficult life for people with mental health problems in people like Zanzibar, and it's just really trying to do what we can to make their life better.
Yeah, I'll just tell you about one patient, a lady with depression that I saw, and that's because we went out in the community and saw her. She basically had depression for God knows how long, weeks and weeks, just sat in the same spot in her house. I think the only reason she got the attention of the services was because I think her husband got fed up. I'm not being like prejudiced against men, don't get me wrong, but she couldn't look after the kids, she couldn't wash up, she couldn't cook, she couldn't do anything. She just sat there and urinated in the same place for weeks. It's a catatonic depression. So, but medication and some caring would really help with that. But it's just that people do, and still don't probably, get seen until it's a little bit sort of long down the line, isn't it?
Yep.
But our focus now, and we're hoping to go out there again, aren't we, hopefully next year, because obviously COVID we couldn't go, and we're just waiting to see what our colleague Solomon wants to do next. At the moment he's training for mental health day, he's training with schools and mental health, that's what he's doing. Yeah. We want to see where we're going, don't we? And then we'll help him with what he wants us to.
But a lot of it is working with the traditional healers, so that, for instance, some of them now, they have a BM machine, so if somebody comes along and they're complaining of the symptoms of diabetes, you know, they can test their blood and say, oh, you're diabetic, and then give them advice about diet and, you know, avoid sugar and the usual stuff. And also just training them. There are some things which you need to go to a doctor. You know, if you've got epilepsy, you need to go and get medication. Okay, so that's us, sams.co.uk. If anybody wants to look at that, it's all on there.
Yeah, thank you very much for listening.
Yeah, thank you.
Thank you. Any questions? Have you got any questions? There must be something.
Thank you. My question was, you've mentioned the tourism sector taking the money away. Has there been any efforts in Zanzibar by, say, the Ministry of Health to try and get those multinational companies to feed the income or employment back into those communities?
They've never mentioned any policy to us. The photograph where we're on the beach is in a place called Pwani Mchangani, and they've got a very nice health centre, and that was paid for by the Italian government, basically, because almost all of those things, I mean, the number of Italians there is absolutely staggering, you know. So there's some. I think that, as far as I know, the Italians just sort of did that out of the goodness of their heart, sort of thing. You know, I don't think that the Zanzibari government actually do anything about that. I know that if you ever came across John Magufuli, the ex-president of Tanzania, you know, he was quite keen on that sort of thing. And I mean, he, you know, impounded ships full of gold dust, you know, and said because there was more gold in it, and he said to the company, you owe us $15 billion in back rates for what you've nicked off us, and until you've paid it, you're not getting your stuff back. So, you know, Magufuli was actually quite good at that, but I'm not aware of the Zanzibari government doing that.
Thank you. My question is a bit related to what Dr. Nova just mentioned. Where I come from, during the COVID lockdown, that's in Lagos, Nigeria, when the government palliative wasn't getting to the people who actually needed it the most, some celebrities took it upon themselves to put the issue on social media, and they created a GoFundMe account where people donated funds, and were able to buy foodstuffs and distribute to people who really needed it the most. So my question is, have you thought about options of GoFundMe for like cases of transportation to the mental health facilities? Since the government, the Ministry of Health's budget isn't big enough to accommodate such expenses, have you thought about going through that means of raising funds probably some of the wealthy tourists that visit the island might be aware of this, and they could maybe out of the goodness or out of empathy donate funds, and probably maybe some people in other countries can be aware of this and they can donate funds. Because I know that we do that a lot in Lagos, and we've been able to create community support for people.
All right. Well, yeah, that's a very good idea.
It is a good idea.
Yeah.
Well, also something we didn't mention, I don't think, is there is a charity called HIPS,
Yeah.
Health Improvement Project Zanzibar, chaired by Peter Andre, and they actually do, and I think that hospital down in the south at
Yes.
Macanducci, that was started by Italian tourists. I think that's now one of the hospitals. There's 2 small hospitals as well. They're not mental hospitals, they're general, but they've got a mental health section in them. One in the south, which, like I said, and then one further in the sort of northwest. And they have a mental health department, and that's funded by HIPS, and that
Yeah.
helps as well, doesn't it?
Yes, that's voluntary.
Yeah, they're voluntary.
But certainly worth thinking about.
Yeah.
Great, thank you. I'm just curious regarding the way you guys work with the traditional healers. So when it comes to the medications, is there a consensus between the patients you guys look after and the patients that the traditional healers look after? Or do you find a situation where both, a patient can actually be treated from both healers? And how do you know what exactly is, I'm just trying to wrap my head around what exactly is going on, and what are the chances that, especially if we don't know what the composition of the medications being used by the traditional healers, and how that could impact on, say, the medications you guys are providing for these individuals. If you can just shed more light on what exactly is going on between what you guys are doing and what the traditional healers are doing with people with this mental health, please.
Well, I'll try and answer that. I think what happens, to be honest, is that most people go to a traditional healer first, because they're local to them, they're in the village, and they're known. And if that doesn't help with their problem, then they'll go to other services. And we don't run these services. We just basically really raise the money. That's not our job. So that our colleague Suleiman and all the people he works with, hopefully they've got they'll have communication, because that's the point. They're training the traditional healers, and they're working together because they're both equal, aren't they? So hopefully they talk to each other and communicate and find out what medication they have had and what's in it, like you say, because obviously that has an effect on people's health. I saw some people. I saw one young lad who went to he went to general, like you say, medical services and traditional healer, and he was very poorly actually. So yeah, you've got a good point. But that's not our remit, that's our colleagues' remit. We can't do the work there. We're fundraisers, aren't we?
Well, yeah.
We do what we're asked to do.
Until we started doing this, there wasn't any communication between the two. And the first thing is to get people talking to each other.
True.
And training the traditional healers that when it gets to this point, you have to tell people to go to the doctor. If you're, with diabetes or epilepsy, or, if you're floridly psychotic, they've got to recognise the bit where they need treatment. So, we're at that stage, and we're doing the training, we're starting to do the training with people, so it's a work in progress. And it is very difficult, and I think that it is a big problem about how these things work together.
It is.
There's a question down here.
Oh, it's not a question, it's just an answer to this question.
Right, good.
I can partly answer you for mainland Tanzania, for the area where I've spent many years working. In the mental health clinics that ran in my department in the hospital, you would often find people switching in and out. So they would be, perhaps they disappear for 6 months, they'd come back. That 6 months would have been spent on traditional medicines or other practices, or on no medication at all, or a combination of, and maybe some self-purchased anti-epileptics, all kinds of combinations really. And then they'd be back in clinic, and just so many reasons and barriers for that, but often it would be the family member who was sponsoring or encouraging that member of their family to attend the clinic had got sick or disappeared or withdrawn, had run out of cash so they couldn't attend and get the free medications in our hospital to be back on the traditional.
Yeah,
and so
that's
up and down, back and forward, over years of either epilepsy or other illnesses. So yeah, really variable, but often a combination or switching.
Thank you.
Right.
Okay.
Good. Thank you very much.